Right, so my computer says it is 12:15. Are you ready to get started?
I am.
All right, so hopefully we have some people joining us. Hello and welcome to our Facebook Live. I am Beth the Santis, the CEO of Fact Forward. And at Fact Forward, we are very interested and we work tirelessly to advance reproductive health for young people and adolescents through comprehensive sex ed, age-appropriate messaging, as well as medically accurate information so that young people, as they're moving through life, have the right information at the right time to make the best decisions to have the best life possible. Hopefully you've seen on our social media that January is Cervical Health Awareness Month. This means raising awareness about cervical cancer prevention. More than 14,000 people in the US are diagnosed with invasive cervical cancer each year, but the disease is preventable with vaccination and appropriate screening. So in celebration and to raise awareness for Cervical Health Awareness Month, today I get the honor of sitting down with our vice chair of our board at Fact Forward, who happens to be the Women and Children's Services Director at the Spartanburg Regional Health System, Hope Garcia, to discuss prevention, testing, as well as her personal experience with cervical cancer. Hope, thank you so much for joining us today and sharing your thoughts about this topic.
Thank you for having me.
I think it would be really awesome, Hope, if you could, share with everybody who you are, and then a little bit about the profession that you chose to be in. And then if you would, we'd love to hear why you chose to serve on our board. It is truly service for a very busy woman, as everybody's going to hear. And then why you chose to go into a leadership role in the vice chair and then hopefully someday be our chair of our board. So tell us about yourself.
Absolutely. It's always weird talking about yourself. But so as you said, my name is Hope Garcia. I'm an RN. I also have my bachelor's and I'm a certified lactation counselor. But I got into nursing, well, healthcare really, when I was 19, so 20 years ago. I kind of started out in the emergency room, did med surg for a while, adult critical care, and then I found myself in women's and children's services, which I like to tell everyone is the land of promise. There's so much to do in women's and children's services, and you can touch so many people. So that's why I truly love it. I found myself looking into healthcare because I had so many mentors in my life that were always related to healthcare. So I wanted to really do something that gave back and was important and worked, around what I wanted to achieve in my life. I got drawn to Fact Forward. When I first heard about Fact Forward, it was still a South Carolina teen pregnancy campaign. And so I am a teen mom. I had my first child at 17. And then by 22, I had 4 children. I now have 5 children. I have a gap there, but so I was a teen mom and my mom was a teen mom. So teen pregnancy has always been near and dear to my heart. And then having 4 girls of the 5 children, it's something you talk about a lot and with my son as well. So it's just something I felt drawn to. And in my role at the hospital, being over women's and children's services, I am allowed to do a lot in the community, which I really enjoy. I really enjoy being part of that. And so it's a conversation I get to have over and over, and the importance of pregnancy being planned and making sure it's right for you. So that is how I found my journey with Fact Forward. Leadership, I will say I was pushed into leadership in my nursing career by some amazing leaders that saw something in me that I didn't, know was there. I was just trying to take care of patients and do my thing every day. And then they kind of pulled me into that. And now I love it because now I get to coach people. I still get to be involved with patients and different decisions. And really, I like forward thinking. I'm always thinking, what can we do better? How can we improve this experience? How can I improve my nurses' knowledge? And it all comes together. It's very much a catch-22. So I really enjoy what I get to do.
Well, that's awesome. Thank you. And thank you for board service as well as doing this Facebook Live. I know you're very busy, so we'll dive right into it. You are definitely a wealth of knowledge surrounding this topic, not just because of what you studied, not just because of the position you are at the hospital, but because of some personal experience as well. Can you talk to us about the experience you specifically had with cervical cancer?
Yes, so as many women do, when I was a teenager, I started getting my yearly screenings or pap smears, and everything was fine. And then in 2018, I went in for my regular visit. It was fine. A few months later, I found out I was pregnant. And so then when you go back in for your initial visit, they do another screening just to kind of start all over. Well, on that screening, it was found to be abnormal, where just 4 months ago, it was fine. So then, of course, I had the repeat smear, which then led to a biopsy, which showed I had cancer, which was, it's not anything you ever want to hear. You never expect it. It was then I learned there was 3 types of cancer, cervical cancer. So there's a squamous cell carcinoma, which is extremely common. It's just on the surface of your cervix, very treatable. You really don't have to do a whole lot with it. And then there's adenocarcinoma, and that's when it's within your cells. So it's a higher grade cancer. And then there's a third that's a mix of those two. And so after my biopsy, I learned I had that third type. And so even though I'm a nurse, I've been in women's health for a long time, I didn't realize I had so many risk factors because I was shocked, right? Like I'm a healthy individual. I work out more days than I don't. I try to eat very healthy. I had personally had no health history besides having kids, and there was no signs and symptoms that there was anything wrong. But I learned that my risk factors were that my grandmother actually had cervical cancer. I had a baby as a teenager. I had birthed more than 3 babies. And I was a former smoker. I smoked for a long time when I was young and dumb. And those all put you at risk for those screening or for cancer. So now I knew that. And so then I started my journey through targeted therapy, which then ended with surgery. And so now I'm cancer free, but I've also become a huge advocate of just reminding women not to skip those appointments. I find so often we think like we're fine, there's no symptoms, so I really got to go every year. You do, because if I had missed one, this would be a different story.
Right.
So.
Well, thank you so much for sharing. It is an interesting story, and having those 2 pap smears so close together with such different results really does drive home for all of us that we need to continue to have those screenings. Let's keep going a little bit by digging into some of the basics of what caused your cancer, which is most likely the HPV itself, which is human papillomavirus. What should parents and young people know about HPV that causes cancer?
So one, there's more than 100 different types of HPV. So many people think it's just like a one and done thing. So there's 100 of them. And those all can be passed along during sexual contact. And HPV affects men and women. And some of those are linked to cancer. It's actually one of the most widely spread sexual transmitted infections.
How would someone know if they have HPV? And then how would they know what type of HPV they have, if it's a risky type or not, out of those 100?
I think that's what's scary about HPV is most people do not know because there's no real symptoms for it. And if you have symptoms, it's probably because it's proceeded to another level of something else. And that's why regular screenings are so important for women. So it's detected with pap smears for women. And then if it's abnormal, there'll be, again, different process. And that's how you find out what type you have. Men also carry HPV, but there's actually no diagnostic test that can accurately determine whether a man is carrying it because he has no symptoms.
Right. Yeah. And I think this is really getting at why it is so great that we actually do have an HPV vaccine now. When you and I were growing up, there was not an HPV vaccine. And so if we can get our young people vaccinated, that would be great. But according to the 2020 data from South Carolina DHEC, in South Carolina, only 47% of the adolescents that are in that target population for when to get the HPV vaccine, which is 13 to 17, are actually up to date. So we've got less than 50% of our young people vaccinated. One of the problems is that it's not on the mandatory list now. What are some common misconceptions or myths that we can talk about that maybe will help people realize that we could do much better and have a much higher vaccine rate?
Yeah, so I think one of the most common ones I hear is people think that the vaccine is just for women. And it's for both, because again, men pass it as well and can get it as well. And it's harder to figure out that they have it. So making sure that everyone recognizes it's men and women that this affects. Also that you're unlikely to be infected. So that there's no need to get the vaccine. It's so common though that they say at least every person will have one type of HPV in their lifetime. That's
Wow.
insane.
Yeah, that is interesting. And you make a really great point, and that is that the HPV vaccine is for both young girls and young boys. That 13 to 17 year age group is when they should receive their vaccination. I personally have two boys. They both have gotten their HPV vaccine, and I was very pleased with our pediatrician's office, right? For the fact that it was just part of the normal vaccination schedule. They explained to us what it was. We didn't have to ask for it. And I was just wondering, how is your interaction with the healthcare system as you took your girls and your one boy through the system? One of them hasn't gotten to 11 yet, or 13 yet. But I was just wondering, how was your experience interacting with the medical community?
I think it's changed over the years. So my oldest daughter is 22. So I still remember having the conversation and questioning it, because at that time, I mean, that was 22 years ago. I did not have the knowledge I have now. And it wasn't spoken about as much as it is now. And I remember them like, do you want this? Do you don't? And it kind of like, it didn't feel like it was as big of a deal. However, then with my other children, it was like, you're going to get this, right? So the conversation changed. Delivery is everything, right?
Right.
And I was like, well, yeah, and now that they'd already had it prior to me getting cancer because they were in that age. So now I don't think that that would ever even be a question, because they got to live through that with me. But definitely how the physician talks to you about it makes a difference, or the provider. I mean, it was just like, well, yeah, of course you want this.
Right. I tell people all the time that my younger one, when he went to go he called it the cancer vaccine. And it was a very interesting conversation, because you had to have a conversation with them. Okay, it's not against all cancers. It's about these kind of cancers.
Right.
But it normalized in the conversation. And hopefully we'll see a much higher percentage as we, as we continue to go forward. Have you ever had to have a conversation with anybody, whether it be another parent or a medical provider, about why we should have the HPV because they're hesitant against getting the vaccine?
We do a lot of talk about vaccinations in women's and children. There's so many, but it's always surprising to me when I find out, someone still with the knowledge they hadn't taken the time to go in and get screened or get their vaccination. And I always, use my story. I wish that I was able to have gotten vaccinated at that age, because that would have changed my journey. And I think being able to share that, not only what my journey has been, but that my children are also vaccinated, that helps, being able to have that discussion, and also being able to talk to, again, boys, why they need it.
That's right. So I think we're pretty much at the end of our Facebook Live here. Just to wrap it up, please, everybody, it is Cervical Health Awareness Month. The take-home messages, two of them. Make sure you get your HPV vaccine on in the proper time for what the medical community recommends, as well as women, please go in for your screenings. This is an important way to keep yourself from having cervical problems throughout your lifetime. It's important, and we have the technology to help ourselves not get cervical cancer in the future, especially for this next generation. It's so important. Hope, thank you so much for taking the time to do a Facebook Live with us and sharing your personal experience as well as your professional, as well as your experience as a mom. We know you're a very busy lady, and taking this kind of time, we really, truly appreciate it. Everybody, please be aware, Cervical Health Month is January. Please do what you need to do to keep yourself and your family members and your loved ones safe. Thanks again, Hope.
Thank you.